I'm in so much pain. Most people who are in pain are taking meds, but maybe, just maybe, medication is not the answer. So when I see patients in my office for spinal problems, for neck, low back, upper back injuries, what they're usually doing is they're taking medications. And the three most common types are analgesics, painkillers, muscle relaxers, and non-steroidal anti-inflammatories. Now, if you are unable to function as a human being, if you have something very, very important that you don't want to jeopardize, you may need to take medication. I mean, I know a guy who said to me, "Doc, I feel so bad. You mentioned I shouldn't take meds," and you'll see why in a minute. But I got this really important deal to close. And he was literally jumping onto an airplane, flying to Canada or the US, somewhere in North America, and he was basically signing off on $1 million deal. I said, "My friend, take the whole bag. Take the whole bag of medications." This was so important to him. He was working years to get to this stage. And I said, this makes sense at this particular time to medicate so you can get there, sign off, get back, and then we'll talk about the natural things you can do. I had another lady who basically said that her daughter's wedding was coming up, and should I medicate? Her attitude is an absolute mess when she's not on medications, and she's grouchy and grumpy, and of course she doesn't want to jeopardize starting the relationship with the new family by being a complete crank bag at the wedding. And so she decided to take medication. But here's what I'm trying to say. Most people, when they think about, should I take medication for my back or my neck problem, is they're usually trying to figure out, okay, what's the best way to feel better? I get that. But the problem with meds is not only are there side effects related to stomach issues, kidney issues, and liver issues, but it does something else. There's a drawback that most people don't really fully appreciate. And that is this. If you have lower back pain and it's worse with sitting, you will naturally, after sitting for a little while, feel this need, this inkling, this urge, this nudge, this cue to get up, right? If, for example, you feel worse when you're on the phone and looking down because it aggravates your neck complaint, then what you'll naturally do is when you've been on the phone for a little while, again, you'll have that nudge, that cue to get off the phone or to change your posture. The problem with being on medications is not only is it not getting at the root of the problem, you're just turning off the pain signal, but the problem is still persisting. But not only that, what's happening is you're now no longer in touch with the postures that you should be avoiding. If you watch a previous video that I uploaded about the golden rule, the golden rule is basically do less of what hurts, so reduce or avoid the things that make your problem worse, such as sitting long, such as being on the phone, and certain postures and positions, and do more of the things that seem to help. Well, how can you apply the golden rule when you're not in touch with that? When you're not in touch with the things that make you worse? I know people that when they medicate by day, they feel great by day, then they have a terrible evening. Or if they medicate at night, they have a terrible day. Why is that? Because when you medicate by day, you're trying to get through the day. I understand that, and it might be necessary for you to do that. But the problem is, during that period of time, you're now doing things that you probably shouldn't be doing. You're doing things more than you should be doing. And when you medicate by night, you're probably tossing and turning without being aware of the positions you should avoid. So medications are not all bad, but it's really important to stay in touch. If you can, if the pain is unbearable, I get it. You may have to medicate. I mean, I usually medicate not because it's painful for me, but because it's painful for the people around me, trying to bear the fact that I'm not medicating and I'm in pain. I personally try to avoid medication as much as possible. For emergencies, they absolutely have a place, but I think for everyday aches and pains, it can cause you problems down the road later on in life when it comes to stomach issues and liver issues and kidney disease. So you want to, weigh out the options of don't medicate, perhaps use ice and heat, and be aware of my postures and apply the golden rule and breathe in a certain way and get my mind working for me instead of against me, versus don't do all that stuff and just medicate. So I think if you want to not only get to the root of the problem and accelerate how quickly you recover from the problem and prevent relapse of the problem, I think avoiding medication might be something to seriously consider. See you next time.